Hello, my name is Brian Jones, and this is going to be my presentation on asthma and the common comorbidities, pathophysiology, treatment medications, and other things that go along with the disease. I'd start off by saying please forgive the background, as this was the only place that I was able to do this quietly. So let's start off by talking about exactly what is asthma. So, asthma is a disease process of the lungs in which smooth muscle bronchospasms happen, causing chest constriction, tightness, coughing, excessive coughing, difficulty breathing, increased mucus production, edema in the lungs, and also severe wheezing. Those are the most common clinical presentations. It is more prevalent in children than in adults, but both have seen a significant increase in the incidence of it over the last few decades. Some of the comorbidities that accompany asthma are going to be over the course of the long period of having asthma, you're going to see a decrease in lung capacity related to the buildup of extra tissue in the lungs and increased edema and swelling. These patients also have a higher risk of pneumonia related to excessive mucus production. And then some of the contributing morbidities that you see along with asthma are uh, some sinusitis, rhinitis, esophageal reflux, obstructive sleep apnea, and also some hormonal disorders. So, the most common type of allergic asthma, which you have allergic and non allergic asthma being the asthma that is related to the process that we're going to discuss, and non allergic being related to irritants specifically affecting the airways and causing constriction. Some people also refer to that as exposure asthma or occupational asthma. And the what's also known as exercise-induced asthma also falls under that category. But as far as the allergic asthma, it is the most common, and that's the type we're going to talk about as far as the pathophysiology is concerned. So typically, what's considered hypersensitive people are the people that are predisposed to this, and the research has shown us that these people create an extra immunoglobulin E, which is an antibody that's not commonly found in people who do not have these hypersensitivity conditions. And the way this process works is um, an antigen enters the body via the airway. And the way, as far as an antigen is concerned, it could be any kind of dust, molecule, pollen, anything that has caused a problem or that the body is reacting to. And what this does is this causes the the mast cells that have extreme amounts of the IgE antibody bound to them. It's going to cause them to actually rupture, and those cell ruptures release all kinds of various chemicals into the body, including slow reacting substances of anaphylaxis, which is the biggest cause of the things that we see with asthma, and along with other various chemicals such as histamine and others. But the slow reacting substance of anaphylaxis in this whole process causes bronchospasm, edema, excessive mucus secretion, and eventually epithelial damage within the lungs and the other airways. And eventually, this leads to airway remodeling, which um, includes mucus gland hypertrophy and hyperplasia. So, testing to determine this disease includes spirometry, lung function tests, and also various challenges either with methacholine or mannitol, but there is no gold standard amongst the asthma community. The common medications that are used include short acting beta agonists such as albuterol for quick relief, and also Atrovent, which works by blocking the muscarinic receptors within the smooth muscles surrounding the airways, and also oral and IV corticosteroids. Long-term medications include inhaled corticosteroids, which reduce tissue swelling within the lungs, the leukotriene modifiers, which block action of leukotrienes, preventing excessive mucus and the tightening of the airway muscles, and also long-acting beta agonists, which are bronchodilators. Along with this also includes bronchothermoplasty, which electrodes heat up the inside of the lungs, preventing amount of smooth muscle available. Lifestyle changes include no smoking or exposure to various irritants, and there is a genetic component that is included, but as we've already mentioned that. And this concludes my presentation. Thank you very much.